Okay, so if you're running a specialized healthcare practice, I'm thinking especially physical therapists, OTs, speech language pathologists,
Mm.
you really know what administrative burden feels like. It's right there.
Hmm.
In the insurance paperwork, just
Yeah.
constantly eating up staff time, creating this background hum of like compliance anxiety.
Oh, absolutely. Yeah, the sources you share, they really nail this. They describe insurance credentialing as, and I quote, tedious, technical, and time-consuming.
Honestly, it feels less like admin and more like this whole separate job that exists just to keep you eligible to even get reimbursed for patient care.
And that's really the heart of our deep dive today. We're looking at how a solid contracting strategy, specifically one driven by um, credentialing automation,
Yeah.
is changing the whole game. It's shifting from being, a nice-to-have convenience
Right.
to, well, a crucial competitive advantage. Yeah, and the need for it really comes down to just complexity. Credentialing isn't a one-and-done thing, right? It needs constant, really meticulous tracking. You're submitting those big Medicare forms, juggling all the different commercial payer rules, constantly updating your CAQH profile,
Yeah.
that central database every payer checks. We're really going to unpack how technology is just fundamentally altering that reality
Okay.
for therapy providers.
So the big question becomes, how can these therapy practices actually cut out all that busy work, avoid those really painful, costly delays, and, gain that strategic edge we're talking about? Okay, so let's start by mapping out the danger zone. Why does sticking with manual credentialing actually hurt practices so much?
Well, manual methods, they basically open the door to huge financial and operational risks. It hits the bottom line almost straight away. The sources you found point to four big ones, and they all really stem from human error, simple delays. The first one's pretty obvious,
Sure.
just lost revenue because payer enrollment is delayed. New therapists can't bill if they're not credentialed yet. Simple as that.
And those billable hours are just ticking away, aren't they?
Exactly. Second big risk. Claim denials,
Yeah.
really damaging denials because of outdated information. Maybe a license expired and wasn't updated fast enough, or the CAQH profile didn't get reattested on time. Happens all the time. Third, you got just plain administrative overload. It leads straight to staff burnout. We hear it constantly from practice managers losing a great front desk person because the paperwork is just too much. That often hurts more than the immediate financial hit itself.
Yeah, that makes sense. And that administrative oversight, it's not just like an annoyance, it's a real financial drain. According to some of the industry studies you shared, these credentialing delays, they can cost a single provider up to $9,000 per day in
Oh.
lost billable revenue. That's like losing a whole therapy room's worth of appointments every single day.
Oh.
9,000 a day, yeah. And the really critical thing to grasp here is that almost all of those delays, they come from simple administrative slip-ups.
Yeah.
Missed emails, forgotten deadlines, typos in data entry, all things that are, frankly, completely preventable. So if the cost of just one human error is that high, well, relying on spreadsheets and calendar reminders, that's just not a sustainable model, not for any practice that actually wants to grow.
Okay, so if the manual way is that expensive, that fragile, yeah, relying on spreadsheets is clearly not working. So
Sure.
let's flip this. What does the actual tech solution look like? This sounds like it's got to be more than just a fancy calendar app.
Oh, it's much more than that, yeah. Credentialing automation uses specialized software designed to streamline, well, every single step of getting a provider enrolled. The real key here is intelligence. It operates without the errors, without the delays, without all the guesswork that just naturally comes with manual systems. It often uses predictive logic, sometimes AI-powered, to kind of anticipate payer rule changes, spot inconsistencies before they actually become errors.
That intelligence part sounds crucial, but let me push back a bit. That speed sounds great, but is implementing this kind of software a massive headache in itself? Like, is there a big learning curve that eats up all the time you're supposed to be saving, at least initially?
That's a really fair point. And yeah, historically, implementing specialized healthcare software could be pretty tough. But the modern systems we're seeing now, they're really designed to integrate pretty seamlessly with the practice management systems clinics already have. They handle a lot of the heavy lifting right away, like pulling in current payer data automatically. So the admin team starts saving time on those really repetitive tasks almost immediately.
Okay, so we're talking about very specific time savers then. What exactly is the software automating? Like, what tasks disappear?
Right. So think about eliminating all those manual compliance checks. The software automates things like reattestation reminders. It's huge for avoiding those common denial errors. It pre-fills complex, really time-consuming forms. We're talking specifically about those tricky Medicare CMS 855I forms, or even just routine CAQH updates. Saves hours of just typing the same info over and over.
Oh, wow. Anyone who's wrestled with an 855i knows that relief is
Yeah.
immeasurable.
Totally. And beyond the forms, these systems are monitoring license expirations in real time. They flag missing or outdated documents proactively, they verify credentials instantly against primary sources, and crucially, the system submits status checks to the payers automatically. So your staff isn't stuck on hold, chasing updates. The system does the waiting game for you.
I really like that distinction. It sounds like it shifts the human role from being like a data entry clerk and constantly chasing down information, a data wrangler maybe, to being more of a strategic decision maker. They can focus on solving the complex stuff, not just ticking boxes. That seems like a massive value add, especially for smaller clinics.
Absolutely. And if you connect that to the bigger picture, this automation, it offers strategic benefits that go way beyond just saving staff time. It's fundamentally a strategy for predictable financial health and honestly for building stronger relationships with payers.
Okay, so where's the most immediate financial impact? Where do you see the win right away?
The most immediate thing is usually a rapid drop in claim denials,
Yeah.
credentialing errors. They're a huge reason claims get rejected initially. Some sources say up to 85% of initial denials are tied to this stuff. Automation just makes sure the data is correct, it's current the first time. That slashes the denial rate.
85%.
Oh.
And how quickly does that translate to getting paid faster once you cut down those denials?
Well, that brings us straight to the speed and revenue piece. Automated systems can cut the total turnaround time for credentialing by up to 50%, sometimes even more. So when you can get new therapists approved and actually billing weeks faster than the competition, that translates directly into thousands of dollars in protected revenue and much better cash flow right away.
And what about the long game? The relationship with the insurance companies themselves. Does being more efficient actually help when it comes time to negotiate contracts or join networks?
It absolutely does.
Yeah.
That's the compliance and reputation angle. You've got built-in compliance alerts flagging issues before they can impact eligibility. But also, think about it. Submitting a perfectly complete, error-free application. It just gives a much stronger, more professional first impression to the payers. And that definitely matters when they're making decisions about competitive networks. You look organized, responsive, low risk. It helps.
Let's make this concrete for people listening. Let's look at some of the real-world numbers you shared from the sources. There was one case, a large multi-provider group. They used automation and cut their average credentialing time down from, get this, 123 days down to just 78 days.
Yeah, that's shaving 45 days, a month and a half off their time to revenue for every new provider.
Yeah.
Huge. And another example you found, an AI-powered platform cut administrative errors by 80%. That's thanks to those predictive alerts and the real-time document tracking we talked about.
You know, what's really interesting here, and maybe counterintuitive, is that small to mid-sized therapy practices seem to benefit the most. It sounds like automation lets them sort of punch above their weight, compete effectively with the big hospital systems because they can speed up enrollment across the board, Medicare, Medicaid, commercial payers, just as fast or faster. Okay, we've definitely laid out the strategic wins, but let's circle back to that core message from the sources. Why is automation now seen as basically mandatory, not just optional, for PT, OT, SLP practices that really want to grow?
Well, the simple answer is really twofold. Increasing complexity and rising risk. The credentialing requirements, they're only getting stricter. Payers are tightening standards all the time. Medicare rules seem to evolve constantly. And those central platforms like CAQH, they're always updating what they need. The whole landscape is just a moving target.
Yeah, and if the rules keep changing, trying to track it all on a static spreadsheet, that sounds like a recipe for, well, disaster, financially anyway.
Precisely. I mean, let's just contrast the two paths forward, right? Practices sticking with manual methods. They're just inherently more likely to miss deadlines. They're more likely to lose out on competitive contracts, delay necessary care for patients who are waiting for that enrollment approval. And ultimately, they risk losing really good, highly trained staff simply to burnout over paperwork.
Meanwhile, the practices using automation, they're scaling up.
They're scaling faster, yeah.
Yeah.
Because they have more predictable, more protected revenue streams, they're improving compliance almost effortlessly because the system is flagging everything for them. Automation basically turns compliance into just standard operating procedure.
Yeah.
Not some big annual panic attack.
Yeah.
And that frees up their internal resources, their people, their time, their energy to focus entirely on patient care and planning for growth.
So it really boils down to this, doesn't it? If your practice's growth depends on staff remembering everything, on guesswork, you're already falling behind. Automation isn't just a time saver for the admin team anymore. It's fundamentally a revenue strategy. Streamlining enrollment unlocks faster payments, yes, but it also provides a competitive edge that's just becoming almost impossible to match doing things the old way.
That really is the strategic shift. Think about it.
Mm.
If the single biggest risk to a clinic's financial stability is simple administrative error and delay things, automation is specifically designed to prevent then how much sort of invisible staff time and internal stress is currently tied up just managing compliance. Time and energy that could be going towards patient care or towards expanding the clinic, that opportunity cost, maybe even the human cost.
Yep.
That's the core trade-off practices really need to weigh now as they plan for the future.
That's a powerful thought to end on. Thank you for sharing all this material with us and breaking it down. We really hope this deep dive gave you, our listener, the insights you need to maybe accelerate your own strategy.